he's married, he's a dad, he's married to Miranda. He has 2 sons, Joshua and Nathan. And he is an anesthesiologist, and a critical care specialist. And he's working in Pietermaritzburg. He's affiliated to the perioperative research group of the Department of Anesthetics and Critical Care at the University of UKZN. And he is also an associate professor there. And he's been serving in the chapter director of Ratio Christi in UKZN Pietermaritzburg since 2017. He's published more than 100 peer-reviewed papers and was awarded the 2016 UKZN Vice Chancellor Research Award. And so he's currently busy with his master's still I think, in Christian Apologetics and philosophy from Southern Evangelical Seminary in Northern Carolina. So here he is. Let's welcome him. So, Father, we thank you for this evening. We thank you for this group of young people gathered here. We ask you, Lord, that you would guide us and lead us in this evening. Be with Prof. Rodseth as he shares. Be with his family far away. Be with us. In Jesus' name. Amen.
Knives. I've got a friend of mine who makes knives, and we're trying to start a company. And there we go, yeah. And then, as you've heard, I run a jiu-jitsu club in Pietermaritzburg. Picked up some injuries, which is why I'm walking with a limp. I'm an anesthetist, which means I put people to sleep for a living. You know, when they're cutting you and you don't run away, that's because I'm keeping you asleep. It also means that sometimes when I talk, people just fall asleep right next to you. So if your buddy starts dozing off, just give them a quick nudge, please. I've done a whole lot of studying, a whole lot of research. I take my academic career quite seriously. And I'm what is called a nerd, a research nerd. So I've published like over 120 papers now. I've been cited over 1,000 times. And the main thing that I've studied is how to identify good research versus just really bad research. How do you know what's good? How do you know what's not good? And a lot of that work I did when I was in Canada, I did a master's in research methodology, which is how do you identify and do good research? Just before we start, I'm not a psychiatrist. I'm not a child psychiatrist. I don't treat people with gender dysphoria. I'm not giving you clinical advice. But I'm speaking today as an expert on the field of clinical medicine and how to do research. And that's actually what got me involved in all of this topic, is just looking at what's going on and going, gee, guys, this is not right. This just doesn't make sense from a medical perspective. All right, introduction's done. Happy? Anybody sleeping in the back there? No? Okay. All right. I just want to ask you this question. Why is there a T in LGBTQIA+? Now, Simon is going to be answering that question today after me. Just keep this in mind. It's a bit of a weird thing when you start thinking about it. We all just say it, but why is there a T in this list? All right. So you are here today because this whole issue of trans and identity and all of that stuff affects you. And you specifically, and you're trying to figure out how, as a young person, you're going to engage with all of this stuff. Wow, that's good. All right. Okay. Is that good?
This beard, I'm afraid.
Is that right?
Yeah.
Good. So, before you can answer the question, who am I, you need to answer the question, what are you? What are you? Hey? Hey? Human. Oh, good, man. Very nice. So, another question. What is this? Hammer. What does a hammer do? It hammers stuff. Yeah. This is a hammer. Hammer hits nails. What's a good hammer? One that hits good. Huh? That's a good hammer. What's a bad hammer? One that doesn't hit so good. It's not a good hammer. I don't want this hammer. What's a good way to use a hammer? Hammer stuff. What's a bad use of a hammer? To hit somebody else, to smash a bottle, to try and open a can of Coke, not a good move. This is a little test that they do for like little grade ones. What's this? What do I use it for? What's an axe? What do I use it for? What's a car? What do I use it for? To know what is good, you must know what something is. All right? That's how we know what it is, what's good, and how to use it in the right way. So I asked the question, what are you? And the answer that I got is a human being. And what is a human being? I mean, you can point to me or you, we're human beings, but what are we? Because what we are determines what is good for us and how we're going to use ourselves. A human being is created by God, which means we are not God, we are a creature. Humans are an interesting thing. We're a mixture of both spirit and matter. We're not just stuff. We're not just this. There's something more to us. There's a spiritual component to us. We are made in the image of God, which means that you are valuable. No matter how you feel about yourself or what's going on in your life, you're created in God's image, so you have value. And you are relational. You have friends, you have family. Nobody exists on their own, and that's captured in the concept of the Trinity. We are created in this image of God. This is what a human being is. And you are specifically created to be in a relationship with God and with one another. All right, that's the good use of who you are or what you are. And God gives us some rules and instructions on how to live. And why does He do that? He allows you to thrive. When you follow God's instructions, you end up with good things, with an environment where you can grow and have fun and laugh and just thrive. That's a word I really like. Okay. I like minions. So let's talk about sex. Ooh. We are designed for relationship with one another, right? And one of the most intimate relationships that we have is a relationship between a wife and her husband, all right? And this intimacy that we have, this relationship that we have, comes through the relationship that God has in the Trinity. Everything that we do is actually just an echo of what happens in God. God is relational, we are relational. And this most intense relationship is around sex. Sex is good in the context of you being married with a husband and a wife. Because when you use it properly, you lead to thriving and growth and love and happiness. And when you use it wrongly, you end up with a smashed bottle, like when you use the hammer the wrong way. Sex is good. It's pleasurable. There's intimacy. It's becoming one with the person that you love. And it has got a concept of procreation. What's procreation mean? Babies, children, yes. And when you have a family, and you have sex, you have kids, and it grows, and it's wonderful, and it's just life, full of thriving. And now we come to the T side of the story. Humans, all mammals, come in two biological sexes. What are they? Male and female. Very, very good. Top marks. So a female is an XX chromosome. When you look at the sex chromosomes in your body, you can identify a female as X and an X, and a man as an X and a Y. There's no discussion or debate about it that humans come in male and female only, all right? You have to go to an university in an English department or a philosophy department for about 4 years before you get confused about this matter. Everybody knows you need a man and a woman and then you have babies. All right? That's how we come. Don't let anybody tell you that there's confusion about it or that sex is not binary. There's man and there's female. I'll talk a little bit more, and if you've got some questions later on, we can talk about this. All right. So now we start getting into this whole concept of what is trans? What does it mean to be transgender? Am I trans? What is gender dysphoria? Can I change my sex? I'm just going to use a few words so that we know what we're talking about, and we're all sharing the same definitions as we work on it. All right. The first thing is, what is gender? So I've told you what biological sex is, right? Male and female. And now I'm going to say, what is gender? Now, gender is sort of like a terminology that's put together. I can say women have feminine characteristics and men have masculine characteristics. What does that mean? If I look at 1,000 women, if I look at all of the women here today, I can pull out certain characteristics from you that sort of like it's womanness. Maybe you've got wearing long hair, maybe you're wearing a dress. Maybe you've got slightly different facial features than what the men have. If I look at 1,000 men, we all got certain similarities. Does everybody have all of the characteristics of all of the females? No. Does one guy have all of the characteristics of all of the men? No. But I can identify the difference between the male and the female. The differences between male and female here are anchored in the biology. You are different because your genetics are different. How you dress is cultural. So look at me. I'm wearing the uniform of the South African male. Okay? See the shoes? I got the jeans and I got the check shirt, yeah? Do you like shoes? They're good? So this is acceptable. If I was wearing high heels and a skirt, how would you feel? Whoa. You'd feel a bit uncomfortable because in our culture, it's not appropriate. Men don't dress like this. If I was in Scotland and I was wearing a dress, also known as a kilt, would that be okay? Yeah, you would. Because culturally, that's how men express masculinity. So what you are doing and how you're doing it changes depending on the culture. It doesn't change what I am, male or female, all right? A gender identity is a bit of a funny thing that floats around, particularly on the internet. It's supposed to be how I feel about my own self. I feel male, I feel female, I don't feel male or female, or I don't know what I feel. Now, I just want to ask you a little bit of this question. You've got to think a little bit here. How do I know what it feels like to be a woman? How do I know? Yeah, but how do I know? What am I? What am I? I'm a male, right? So how do I know what it feels like to be a woman? I can only tell you what I think it feels like to be a woman. If you are a woman and you look at men, you can't tell me what it feels like to be a man. You can only tell me what you, as a woman, think it feels like to be a man. There's this guy called Thomas Nagel. He's a philosopher. He says, what is it like to be a bat? All right, close your eyes for a second. Think. What does it feel like to be a bat? So you're flapping around there. You're going crazy. You're eating all the mozzies. All right? Okay. Now, stop for a second. Open your eyes. And realize you don't know what it feels like to be a bat. You only know what you as a human think it feels like to be a bat. Do you understand what I'm saying? You can never know what it feels like to be a bat. You can only, as a human, imagine what it feels like to be a bat. How can anybody who is not male know what it's like to be male? You can't know. How I express my gender comes across, as I've said, how I dress, how I speak, and we always put them in the categories of masculine or feminine, and it changes depending on culture. Like I said, not all women have all the feminine characteristics, and not all men have all the masculine characteristics. So look at this. What is this? Describe a normal dog to me. 4 legs, tail, ears. Look at this. No leg. Doesn't look like he's got much hair. Doesn't have a tail. No ears. Are they dogs? Yeah. They are dogs. Just because they don't look like your average dog doesn't mean they're not dogs. We can understand that there is an essence, there's something central about it. This is a dog. All of the stuff that you have in front of you here, how you look, how you dress, those are accidental things. They're not the core of you. They're not the essence of you. When we talk about sex, when we talk about gender, all of this other stuff flows out of your biological reality. Gender is not something that you make up. It is not a social construct. You will hear this often said in some of your classes at school, at universities. It's not true. There's no evidence to support it. It's philosophical stuff that people make up, and someone will talk about this. Your gender is anchored in biology. Biology is the reason we talk about male and female. You cannot avoid the male and the female because that's the reality of our biological sex. It is all about that essence. Our expression differs. We change in how we talk about it, but you can't separate gender from sex. It's like trying to separate the waves from the ocean. You just can't do it. You get into deep, dark waters very quickly if you do. All right. I want to talk about you just for a second and your gender. So you are going through this really weird phase of your life, so most of you, called adolescence, teenager. You are unsure about a lot of stuff. You don't know who you are yet. You don't know what you're going to do. You don't know anything about yourself. You're starting to develop it and starting to grow into it. And you're unsure about a lot of stuff. Just because you are unsure of who you are does not make you gender dysphoric or transgender. Adolescence is a normal part of growing up. You, in this process, are establishing who you are going to be. There's this fascinating thing. When my son was like 2 or 3 years, he has no personality. What I mean like that is there's stuff that makes him laugh, but he doesn't tell jokes. He can't tell me about what his favorite music is. Now he's 8. Now he tells me, Dad, I like this. I don't like this. He's starting to develop his personality. You guys are going into the phase where you are starting to understand who you are. Just realize as I talk about this whole issue that just because you're unsure about who you are at the moment doesn't mean that you have something wrong with you. You don't need a diagnosis. You are going through a process called adolescence, growing up. This is a normal process. I like minions. I'm going to give you 3 ways to think about this whole trans debate issue. Okay. And what I'm trying to do is to give you little categories to think about it and to talk about it in a meaningful, careful way that you don't get confused. Okay. There's going to be a test at the end of this thing. That's a joke. I can see you guys looking nervous. Check how scared you're looking. All right, look over here. Who's this on the left-hand side? Hey? Caster Semenya. All right. Caster Semenya is the first person I want to use an example of this category called a disorder of sexual development. All right. Look at me. Do I have a lot of hair on my head? No. I've got adult onset alopecia. It means I'm balding. The reason I'm balding is that I inherited that from my grandfather. All right, my dad's got hair, but my grandfather's lost all of his hair. I've also got an autoimmune condition where my body attacks my joints. I'm taking a whole lot of stuff. When we get born, we inherit genetics that sometimes goes a bit wrong because we live in a broken world. And just like you can get problems with your hair or your heart or your lungs or your joints, so you can have problems in how you develop your sexual organs and your genetics of your sex. And this is called a disorder of sexual development. People also used to call it intersex, and you will also have heard the term hermaphrodite. So you've genetically inherited genetic material that is not normal, that's scrambled slightly. And the most common one that we see, and the reason that we know about somebody like Castor Semenya, is you are born with male chromosomes. So you are XY. Your body's blueprint is make a man. You've got testes that make testosterone. But you've got a problem with the hormones in your body, that testosterone can't bind to your cells, or there's a damage to the way that it works. Now, a normal human that is not exposed to testosterone will develop as a female. So you've got a genetically male in the uterus. So there's a little fetus that's busy growing. It's making testosterone, but the body doesn't respond to testosterone. And so the child grows as a girl. And when he's born, they say, "Congratulations, Mom, you've got a girl." Because the child doesn't have a penis, it looks like a girl. And so the girl starts to grow. She's got testes. If you test her blood, you'll see the testosterone levels are high. And there's some response to that testosterone. So the child starts to grow, and she hits adolescence, 13, 14, goes through a growth spurt. Testosterone levels are high. She starts to grow, and her face becomes a little bit more masculine, and her muscles become stronger, and she starts to grow in length. And when she runs fast. And so she wins the races at school, and she wins the races in the region. Then it's provincial, she's winning. Then she goes internationally, and she wins. And then they drug test her, and her testosterone levels are 2 to 3 times higher than what a normal woman would be. And then all of a sudden there's a big problem. This is the story of Castor Semenya. Castor Semenya has a disorder of sexual development. This is not uncommon in sporting for exactly this reason. In sprinters, high jumpers, shot put, any power event under about 1,500 meters, if you've got testosterone, you're stronger, you're going to win. All right. This is not being trans. This is a different thing altogether. This is a medical condition that's linked to either your genetics or to your hormones. It is the wrong thing to do. It's not the right move. It's illegitimate. It's a bit of a crook. To point to Castor Semenya and say, "Oh, she's trans," that means that this thing is over here is the same. They're two different conditions. They're two different entities. They're two different ways about thinking about what's going on. So when you have a discussion about trans issues in South Africa, 90% of the time people will go to Castor Semenya as an example of this whole story. But that's not legitimate. That's not the right thing to do. It's not the right way of thinking about it. Does that make sense? Okay. So two broad categories, as I've said. There's genetics and hormonal. Castor Semenya. The reason that I show you here is because that's the one that doesn't quite fit in there. All right. Disorder of sexual development, DSD. Ready for the test, eh? DSD. All right. The second category is the person that we learnt about in medical school as somebody that is transgender. And this is Caitlyn Jenner, who used to be Bruce Jenner. Bruce Jenner was a man who competed in the decathlon in the Los Angeles Olympics, won gold. And then decided that he was actually a she and became Caitlyn Jenner. And then was crowned Vogue, which is a fancy magazine's Woman of the Year in 2017, which is an absolute insult to all women in the world. So he became a she. This is the classic example of a trans individual that I learnt about when I was doing psychiatry in medical school. This person has got what we call persistent, which means ongoing, gender dysphoria. Gender, the way that I feel about who I am. Dysphoria is a sense of unhappiness or a sense of unease. It happens most commonly in men. 1 in 20,000 to 3 in 20,000. And in women, 1 in 50,000 to 1 in 30,000. This is so rare that I never saw a single case in all of my time in 6 years in medical school. You just didn't see it. And when it did happen, it happens a lot more often in men. And what is this? This is a sense of, as it says over here, a debilitating unease between my biological sex and the way that I think I should be. And it's like deep inside of me. It affects all parts of my life. And I'm unhappy all the time. I've got anxiety, I've got depression. There's high incidences of suicide. There's high incidence of alcoholism, drug abuse, difficulty to hold down a job. It's overwhelming. It's a really big issue. But it is incredibly small. Like we almost didn't see it. What's interesting is that back in the day, before about 2000, if a child came to you with gender dysphoria and you were a psychiatrist, a child psychiatrist, and you looked at 100 kids that came to you, out of those 100 kids, 60 to 80 of those 100 kids, after they'd gone through adolescence, were no longer having gender dysphoria. Because think back to what I told you right in the beginning. The process of going through adolescence is the process of understanding who you are and becoming who you are going to be. And the process of you being exposed to life, the hormonal impact that's happening inside of your body, the fact that you are exposed to testosterone, to estrogen, you will be channeled into the person that you are going to become. And at the end of your adolescence, you become who you're meant to be, and 60 to 80% of those people no longer have gender dysphoria. And we don't know which of them will persist, and we don't know which of them will stop. And the rule in medicine is if you don't know, don't hurt anybody. So the rule is first do no harm. If I don't know what's going to happen, I need to make sure that I'm not going to hurt you. So, how's this? Is that better? Okay, so what do we need to then say is, let's say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So everybody here in the first two rows, quickly stand up for me. All right. Let's assume you guys have got gender dysphoria, all right? Okay, so sit down. 1, 2, 3, 4, 5, 6, 7, 8. Sit down. These three in the end, out of everybody here in the front, only 3 are going to have a problem at the end of when they're 20, 21 years old. Thanks, guys. Should I give everybody in the front row treatment to fix this problem? So he's not going to have a problem, she's not going to have a problem, not a problem, not a problem, not a problem, not a problem, only those 3. But I don't even know that it's those 3. It could be any one of this. So the rule in medicine is don't hurt somebody if you don't know what's going on. And the rule back in the day, before 2000, was watch these people, help them, because none of this gender dysphoria stuff happens by itself. There's a lot of other stuff going on. A lot of people have got depression, they've got anxiety, they've got other issues like autism, Asperger's type disease. Some people are abused. One of the ways that gender dysphoria can come around is if I'm a girl, and I'm becoming a girl, I'm going into adolescence, and then I'm abused, then it's safer for me not to be a girl, and I will start to identify as a boy, because maybe that might protect me. So you are not just one thing. You're a complex individual. You are not just gender dysphoric. People are complex. They've got anxiety issues. They've got home issues. They've got depression issues. So the way that we treated these people was to love them, to show them, give them support, psychological support, and to watch them go through the process. And then try and help the individuals as the 7 out of 10 no longer have a problem. What people then thought at one stage was, hang on, what we should do is these people want to be a girl, as a guy that wants to be a girl or a girl that wants to be a guy. We should help them to become what they want to be, because then they'll feel better. So that happens in 4 steps. This is called a Dutch protocol. It was the Dutch first did it, and it's been adopted around the world. This is called gender affirming care. 4 steps. 1, socially transition you. So I say, I'm Reitze, I want to become Rachel, I want to become a girl. You must all call me Rachel. I will dress in dresses, and when we talk about me, you need to use she, he or she, so she or her, and I will use the girls' toilets, and I will swim with the girls' swimming team, and I'll compete in the girls' areas because I am a girl. That's social transition. The next thing that happens is before I go into puberty, they're going to give me medication to block my puberty so that I don't start to develop as a man, an Adam's apple. I don't get any facial hair. I don't get like taller, keep me short by blocking my testosterone. Those are puberty blockers. Then at around 16, you give me cross-sex hormones. You start giving me estrogen so that my voice will change. My skin will become slightly lighter and sort of a little bit rounder and softer and more feminine. And then at some stage, surgery. And the most common surgery that people do is what's called top surgery. So for women, they get mastectomies, and for men, they get breast implants. Most people don't have bottom surgery because there are significant, major, long-term complications when you start messing around with the genitalia as a result of the fact that the urinary tract is there, infections, deaths. It's a disaster. Does this work? What's the problem? These people don't feel happy about themselves, right? The question is, does helping them in this way actually make them feel better? That's what we're trying to do. Here's an article, 2023, up to date, lists all of the issues and complications and concerns that we have around gender-affirming care. I'm going to show you a few of them. The short answer is, it doesn't make people feel better. So now out of the group over here that had gender dysphoria, I'm going to treat all of you with gender-affirming care because you're gender dysphoric. And the 3 that have actually got the problem don't actually feel better at the end of the process. And this is not something that doesn't have a consequence to it. All right, happy. First group, what's that called? DSD, disorder of sexual development. This group, persisters, gender dysphorics. Okay. And now we come to the thing and the reason why I get invited. I've done this type of talk at least 50 times in the last 3-4 years to schools and to churches is because of this thing called rapid onset gender dysphoria. Rapid means fast. All of a sudden, you get gender dysphoria. This is a totally new thing. It's never been described before. In around 2000, we started to see it. Out of almost nowhere, there's this spike in young girls, particularly between the ages of 14 and 18, brackets adolescence, and they become gender dysphoric in clusters, in groups. So the girls know each other somehow at school or in the same sporting events or some social things or online. This has never happened before. It's always been individuals, and it's predominantly been male. And these girls don't have any prior history of gender dysphoria. They become gender dysphoric all of a sudden. And it acts like a craze. I've seen this in Pietermaritzburg, where we had an outbreak event of gender dysphoric children at one of the high schools. And within about a month, it was at another high school. There's 2 or 3, and then at another high school. And it goes up, and then it goes down like that. It's also a massively high social value event. When you come out as trans or gender dysphoric, particularly today, everybody thinks you're a hero. Well done, you're so brave to do it. Now imagine that you're a little bit different. You're not quite fitting into class. You know, your friends are picking on you. Maybe you're a little bit overweight, don't quite fit in. Maybe you're not butch enough as a guy. Maybe you're a little bit too butch if you're a girl. You come out as gender dysphoric, all of a sudden it explains who you are. Everybody thinks, oh, that's so great. And in the school, in your social environment, you shoot right to the top. It is common in adolescents who've got depression, co-depression, anxiety, often children that have got cutting disorders where they cut, or eating disorders. When I do these talks at schools, all the teachers start doing this, yes, because they recognize this pattern. And it's strongly, strongly, strongly driven by what we see on social media. The rules on social media is, if you think you're trans, you are trans. That's number 1 rule. It doesn't matter that your parents might have died in a car accident, that you've just lost a brother, that you're sick, that you've been abused. It doesn't matter what you're thinking or feeling. If you think you're trans, you're trans. The second rule is nobody cares about you except us online. So don't talk to anybody else. Only your glitterati family online understands you and knows you. And the third rule is get testosterone. Because as soon as you get this testosterone, then you're going to be okay. And it's very strongly linked with activists and the woke movement that Simon's going to be talking about today. And in some cases, people say, why do I even need to be gender dysphoric? If I want to be a girl, why can't I be a girl? Who are you to stop me? Hey? This is what one of these Dutch researchers say. We don't know whether the studies we have done in the past can be applied to this time. Many, many more children are registering and also a different type. Suddenly there were many more girls who feel like a boy. While the ratio was the same in 2013, now 3 times as many children who were born as girls register compared to children who were born as boys. This is what we're seeing, is that this is a new thing, totally new. And see what he says, I don't know if any of our research can actually be applied to these children because it's something totally different. And this is how I got involved in it, where people are saying, we know what's going on. We got all the answers to this. Oh, it's settled science. Rubbish. We have no idea what's going on. We have no idea of the consequences. We don't know why it's happening. We don't know how to manage it. It's a fad. It's a craze. This is what's happening in Finland. These are the people coming out as gender dysphoric. Nothing, nothing, nothing. Internet explosion. Massive numbers. Research starts to come out in Finland, in Sweden, Norway, showing, whoops, the stuff actually doesn't lead to the outcomes that we see. 3 girls sue the government and raise a whole thing against them, saying, you guys are hurting us, you're damaging us, and check what the numbers do. They go down. If this were a true thing, why would the numbers go down? These are the numbers in the UK. About 5 years behind Sweden. Nothing, nothing, nothing. Massive numbers. A girl called Kiara Bell sues the UK government and says, I was confused, I didn't know what was happening to me. You all of a sudden made me gender dysphoric. You did a mastectomy on me. You gave me puberty blockers. You destroyed all my fertility. You didn't even counsel me on it. Huge court case. And the numbers are down. In countries that have got a health system that oversees them, right? So Finland, England, Australia, Scotland, France, all of these entities have made statements saying, we don't know what we're doing. We need to be careful with gender-affirming care. You may not give gender-affirming care without being in a clinical trial. It's not settled science. It's only in countries like South Africa that doesn't have an overarching medical agency that oversees them, or in the US, where guys are still going crazy around this thing. I'm just going to break it down to little bits. Social transition. So I dress as a girl. What is the impact? There's no robust evidence for the benefit or harms of social transition of children and adolescents. The latest CASH report from the UK strongly discourages social transition because of the impact it has on you and the people around you. Puberty blockers. People don't know why the guys are giving them puberty blockers. If you just give a female testosterone, you don't need to block her puberty at all. It doesn't have clear mental health benefits. There's concerns about bone maturity. There's concerns about how your brain develops. What happens when you block somebody's brain and then start to expose them to a different type of testosterone or estrogen? How does your brain develop? What's the long-term impact of that? If you start puberty blockers, you almost 100% of the time will transition. So every single one of these guys, these 10 that came to me as a doctor, every single one of them will transition, where previously 7 out of the 10 wouldn't transition. Cross-sex hormones, you take a male body that's designed for male hormones and give me estrogen, you're going to pay a price for it. Changes my blood clotting, increase in strokes, increase in heart attacks. In women, they're getting testosterone. There's a whole litany of issues. Particularly, it looks like a brain cancer called meningioma. High incidence, there's an increased incidence in people, in women that are taking testosterone. Think of how complex your body is. And now all of a sudden I started to give it a totally different drug, totally different hormone. This is a big review that came out this year. It says systematic evidence reviews demonstrate the poor quality of the published studies. There is not reliable evidence to support gender-affirming care. This organization is one of the world leading organizations pushing gender affirming care. It's an organization of people that decided that they were the experts. Half of them aren't doctors. There are no official representations of any medical bodies in the world on this group. They've leaked a whole lot of files and documents that showed that the doctors there know that their patients don't have the ability to make an informed decision. How do you, when you're 12 or 13, how can you make the decision that you will be infertile for the rest of your life? I mean, my boy, Josh, in the mornings, he can't even figure out which pair of shoes he's going to wear. Now he has to make a decision that he will become a girl and he will never be able to have children again for the rest of his life. Think about how you feel in the morning sometimes. You're going to tell me that you can make the decision to cut off your breasts, never bear a child, take testosterone for the rest of your life? Like, does that really make sense? Okay, take a breath. Right, what's that? DSD. What group is this? Persistent gender dysphoric. What's this over here? Hey, you guys are smart, man. You, most of you, are going through adolescence. All right. It's normal to be unsure. You do not need to go to a doctor to get a diagnosis, to understand what's going on. Going through puberty is not a medical problem. It's part of you growing up. It's hard. It's confusing. But the process of you going through this helps to settle you into the person that you're going to become. To change your body is not to change your mind. If I think I'm thin, I'm fat, and I don't eat, and I start to lose weight, and I tell everybody, oh, but I'm fat, and you don't give me food, and you don't give me food, that's a disease called anorexia, where in my mind I think that I'm fat, but my body is busy starving to death. Nobody goes to that person and say, oh, you think that you're fat, oh, you are fat because you think that you're fat. The problem here is that if you've got gender dysphoria, changing the outside doesn't affect or fix what's going on inside your mind. We need to talk about and deal with and help people to deal with the multiple aspects that are driving these issues of gender dysphoria. You do not have gender dysphoria. You are going through adolescence. I think this is the picture that we're seeing in the UK and Finland, is that people that are unsure about what's going on, all of a sudden, oh, and maybe you don't fit into the category perfectly of I'm this feminine or I'm this masculine. I don't have all of these traits as a boy, or I don't have all of these traits as a girl. Male and female are not stereotypes. Male and female are linked to your genetics, and how you express them, you have the freedom and the ability to do that by yourself. Being unsure about your gender does not make you gender dysphoric. Where's your true identity? If you're a Christian, you are created by God. You have value. You are built for relationship. You are built to be both flesh and spirit. That's what you are. You are created by God. But if you're a follower of Jesus Christ, you are something new. Corinthians says, therefore, if anyone is in Christ, he is a new creation. The old has passed away. Behold, the new has come. In Jesus Christ, I am not an anesthetist or a jiu-jitsu whatever. I'm not trance. I'm not a depressive. I am a follower of Jesus first. That's what my identity is. What am I? I'm a human created by God. Who am I? I'm a Christian. I'm a follower of Jesus. That is my core identity. If you've got that as your foundation, going through adolescence becomes just a little bit easier to handle. Thank you very much.